Welcome, everyone. This is Healthcare for All Washington's second Wednesday speaker series. We will be talking about advocates, our work that advocates from both sides of Columbia have been developing in order to move the rest of the country forward in universal healthcare for everyone. Healthcare, two people from Oregon, Charlie Swanson and Sandra Coyner, will be joining me and Marcia Stedman from Washington as we share the questions or lessons that we learned during the summit of healthcare advocates from Washington and Oregon. The summit was held on July 15th. And we have developed a couple of key questions or key issues that we have questions about, and we will be answering those questions as we go through the evening. We will close with an update from Chuck Pennachio, the Executive Director of One Payer States, and Chuck will lead it. We'll talk to how Washington and Oregon are doing the work that can lead the rest of the nation along the pathway to universal health care. There is a closed caption at the bottom of your Zoom screen. You may have to hover a little bit, or on my particular screen, I have to push the three buttons on the right, but it pulls up a message that says captions, so you can use closed captioning to follow our conversation tonight. So that's available on each of your computers. Let's start with the land acknowledgement. I'm participating in this Zoom meeting today all across a couple of large states, but I'm calling in particularly from my home in the land of the Coast Salish people. Please take a minute to acknowledge the people that are in the ancestral homelands and traditional territories where you are joining us today. Our efforts to achieve healthcare for all include universal healthcare coverage for the Coast Salish people, the people of ancestral homelands and traditional territories of the indigenous peoples of the shared waters of the Salish Sea within the Duwamish, Suquamish, and Tuhalip nations. And first, let's start by introducing ourselves. We will ask first for one of our Oregon partners to and introduce yourself. Sandra, why don't you go first?
Hello, I'm Sandra Coyner. I'm a retired college professor. I'm on the board of HCAO, which is a 501c3, and HCAO-Action, which is the associated 501c4, and have been pretty active with legislative committees and a whole lot of other stuff with these large organizations.
Thank you, Sandra. So now if we could bring in Marcia from Washington State, if you could unmute yourself.
Sure, thank you. And good to see everyone tonight. I'm Marcia Stedman. I've been working with Healthcare for All Washington as a volunteer in many aspects for about 11 or 12 years, and still going strong. With the help of everybody else, we're doing a great job. But I have a background in customer relations, most recently in the travel industry, where I solved problems and made people happy as much as I could. So now we got a big problem. I'm trying to solve this big problem, and boy, it's a lot tougher than the other. Then my bed was too hard. There was a language problem in Paris. So I'm in this for the long haul, and I'm glad to see you here too. And so really looking forward to hearing what you say tonight.
Thank you, Marcia. And let's bring in our fourth contestant tonight. No, our another representative from Oregon, from Healthcare for All Oregon. Charlie, can you unmute and introduce yourself?
Yeah, thanks, Ronnie. So I'm Charlie Swanson. I am from Eugene, Oregon, and I'm a retired physicist and president of Healthcare for All Oregon Action. And I've been working on this single payer issue for about a dozen years.
And I am Ronnie Shure. I'm the president of Healthcare for All Washington. I'm a retired pharmacist, and since I became a pharmacist, I noticed it right away, and has really helped lead my commitment both as during my career and also as a retiree. I've been able to dedicate full time to volunteering with this organization. So Ron Lovell has entered the questions that we're going to be asking or discussing tonight, and we certainly want your feedback. So as we're going along, please throw a note in the chat to help us identify your question. But the first one is, what is or could be your role as a healthcare advocate, your role with the general public? Why don't we start with a couple of comments from our Oregon partners?
I'll be happy to start off with that. In Oregon, we anticipate that we will not be able to achieve single payer in our state without a ballot measure. It will either be that the legislature will say, yeah, let's have single payer, and the opposition will demand a referendum, or it will be that somebody, we hope the legislature, will refer the product of our current governing board to the ballot. In any case, our relationship with the general public, the bottom line is we have to have a relationship with the general public such that they will vote for single payer. In order to do that, we've been working for a number of years to organize the general public to support single payer. So we work on a lot of ways. One is to organize people into chapters. Another is to organize people electronically through a giant email database. We work with the general public to raise the money to make all this happen. We work with the general public, not just ready for the ballot measure, but also to organize constituents so they can be citizen lobbyists for their legislators. This seems to be quite effective. If we're good enough at organizing the voters and good enough at letting the legislators know where their voters stand, we can get at least a couple more votes in the legislature. But for Oregon, the bottom line is be ready for a ballot measure. And that means trying, when you're working with a legislature, you can say, such and such Republicans will never vote for it, forget about them. When you're working for a ballot measure, you can't write off any district, you can't write off any part of the state. Every individual vote in favor of that ballot measure counts. So that's what that issue is all about, is how do we organize people to vote for this when it comes right before them on their mail-in ballot.
And so one way, to reach a lot of people is through the democratic process. So it's exciting to hear that there are things that we can work on. Marcia, can you answer that same question about the general public? What could be our role?
Legislators, yes. Well, we have been actually a dedicated group has been working with some legislators for a long time and with some success lately. I can speak to my own experience. When I first began in this fight, struggle, I was fortunate enough to be able to be in the same room with Senator Fraucht, David Fraucht. He's retired now, but and was able to engage him in conversation and said, well, what about, this Affordable Care Act? We can have our own plan, but we have to have a plan in place in order so we can have single payer healthcare in Washington. And he was already on board with the idea of single payer, but he wasn't really aware of how to get there. And so I think in some small way, just reaching out, everyone just reaching out whenever you see a legislator and have a conversation with a willing legislator, somebody that is, could be on your side, and ask them to stand up for this. Get a plan, a few years for him to really, for something to happen. We can talk about that later. But yeah, legislators, really important. I would like to say one couple more quick things, which is in Washington, we did a ballot measure in 2000 and did not get enough signatures to go on the ballot. So we switched and made our ballot measure into a bill. It was called the Washington Health Security Trust. It was heard in several legislative sessions in the healthcare committee in House or Senate several years, but it didn't advance. And so finally, David Fracht was in a meeting with us, and he said, well, and would you consider taking elements of your bill and taking them aside and going piecemeal? And so we thought, well, okay, maybe that's what we have to do, because we're not making any headway with these hearings. The bill doesn't go anywhere. So that's what happened to, I wanted to just say in closing that on this topic that we are now in the Universal Healthcare Commission territory. And so we're still working with legislators, working on piecemeal, incremental steps on the way to making the infrastructure for a universal system that could work here in Washington State. There's a lot of moving pieces, and that's a whole nother topic for several other meetings. So that's it. Thank you.
Thanks, Marcia. So Charlie, can you answer that question about your role with the public, the general public?
What has been done in Oregon. So early on, we had HCAO had a speakers bureau, which was intended to try to find places to publicly present information about single payer. In general, it was for meetings of, we went out and did talk to a number of different organizations. It also was an effort to have house parties, which would just be neighbors talking with each other. That has not happened very much recently, but it certainly could happen more, and especially as it gets closer to the point where we think there may be a ballot measure, that's probably going to have to happen a lot more. But a lot of that has to be done long before that, because there's a lot of people that need to be reached. So I guess I'll stop at that point.
So thanks, Charlie. And as far as working with the general public goes, it has been exciting to get invited to different groups that are discussing ways to expand healthcare to everyone, and finding people that really have those similar interests, and finding underlying factors. There are some uniform desires or goals in a lot of different community groups, and we're able to share this justice issues that lead us to participate in healthcare issues. So it has been fun important to make the connections on those levels with the public. And I saw a question already, or a comment from Sam Metz, who wanted to answer that same question. Sam, do you want to unmute yourself? I'll see if I can find you and highlight you. So
thank you, Ronnie. You don't need to highlight me. I'm Sam Metz. I am a recently retired, rapidly aging anesthesiologist in Portland, Oregon, and the acting president of the Oregon chapter of Physician for National Health. Wanted to let people know that meetings with legislators don't need to just happen. You can arrange a meeting with your legislator at this level. You will get the meeting. I recommend essentially a 3-sentence conversation with your legislator. over coughing. One is the healthcare system in this state has failed me, or failed my family, or my business, or my clients, or my employees. Two, I want a universal healthcare system in this state or this nation. And three, I want you to make it happen. Then, sincerely, your voting constituent, then you say, how are you going to respond to this? And of course, if they say, I have no idea what to do, then if you're in Oregon, you can say, I know this loudmouth anesthesiologist in Portland would be glad to tell you what to do. And if you're in Washington, you have your own resources. So contact your legislators. Good plan.
And so that really brings up the next question, which is about legislators. So Sam, thanks for pushing us or leading us into that discussion. Marcia, do you want to jump into a legislative? You've kind of mentioned previous.
I think I already jumped into it, so I was premature. But just to say that I see that there is a legislator that is a healthcare champion here on the call tonight, Patty Kuderer. So shout out to Senator Kuderer for joining us, or she was earlier. I haven't looked lately. I'm glad you're here. So yeah, I mean, that was really, and Sam, I really appreciate your lining up the asks of legislators and the important thing to aspect to contact your legislators, because we have done that for years in Washington. And that is the reason that we do have these identified champions in the legislature now over the years. And that's definitely, yeah, tell your story, tell them what you want, tell them that you want them to do it, and then ask them to get back to you. So thanks for highlighting that, Sam. So it's just, we just have lately gone and with lobbyists to help us and getting appointments with legislators that we know we need to talk with if we don't already have a relationship with them. So in addition to the relationships, we've actually hired contract lobbyists to do this work for us of contacting them. And our current lobbyist is really good at contacting agency people too, agencies, something that, that really helps us, I think, at this point, because we're deep in the Universal Healthcare Commission and making things happen here, if we slowly but surely.
So thanks, Marcia. Charlie, do you want to jump in about healthcare champions, which you've been so successful at developing or had success in developing in Oregon?
So one of the things that we have done and this is mostly prior to COVID, we organized legislative constituent contact teams. The intent was to have such a team in every legislator's district. It would be hopefully about 3 constituents for each legislator. And the intent was to meet fairly regularly with the legislator prior to the session, during the session, to go to town halls when they had them, and to develop a relationship with that legislature so that you could ask them the sorts of things that Sam Metz had brought up, and that you could determine whether they would be a champion and what sorts of things they might support, and what you could do to get them to support more of the things that you would want them to support. It also helps to develop those sorts of relationships prior to a person being elected into the legislature, if it's possible. So when new legislators apply to run for office, it's useful to try to discern what their feelings are and to see if they are open to being supporters. With our champion in Oregon, Senator James Manning, we didn't have to push him to be a supporter. He came in as a really, really strong supporter. And he was willing to kind of lay his body on the line to get the bill that we got through this year. So he has been a very good champion. And actually, as Sandra mentioned, I did have a relationship with him prior to him first becoming a senator. So it helps with that. I wanted to say one more thing about reaching out to the general public that which I didn't mention earlier, and that is it's good to make use of the chances that you have to reach them. And so, for example, when the amendment to the Oregon Constitution to declare healthcare as a fundamental right ran, we wrote something for the voters pamphlet, which was in support of that amendment, but pivoted very quickly to say, well, how can we best achieve the desires of this amendment, and to argue that single payer was a good way to do that. So some people read the voters pamphlet, so I think we reached some people by doing that. And I think it's good to take whatever opportunity you can to reach the general public and things of that nature.
Thanks, Charlie. I see a couple of comments in the chat. So perhaps we could pull up Senator Kuderer said she has some advice from her experience. So I'm going to go ahead and bring you up, and if you could unmute. And you shared that you wanted to share a couple of comments on universal health.
Hello, everyone. I'm Senator Patty Kuderer, and Marcia, it's good to see you again. I've been a supporter of universal health care going back 30 years from the birth of my daughter. Had a pretty horrible experience with the healthcare insurance at that time. And I was working on, a bill to how do we get to universal health care many years ago. And that's when staff said to me, that really needs to go through the insurance commissioner's office. And this was going to be my suggestion, is that, and it's also the reason that I am running for that office next year, is because I want to champion in that role for universal health care. This is not a situation of whether we do it, it's how we do it. And we have to be putting people in positions who can make it happen now, because the time's just going to keep ticking away, and there's going to be people who are absolutely financially ruined by medical bills. And we have a system that is designed to treat people at the end when things are really, really, the problems are really bad, as opposed to being much more preventative based. We can do this. I've talked to legislators from Oregon and California and Hawaii and Alaska, and there's a real interstate healthcare compact that we could do with a single payer via a federated board that would be in charge of negotiating the contracts and doing the claims and all of that. It's still being formulated, obviously, because we need to have the insurance commissioners on board with this. So I don't know if the folks in Oregon have connected with your insurance commissioner about this, but we need to get insurance commissioners moving in this direction so that we do understand that we do all agree on this call anyway, with the exception of maybe the disruptors, that healthcare is a human right. But if we're going to get to that place, we have to make sure that the people who are going to be running the system have that attitude as well, and have a vested interest in making sure that it works. So that's what I wanted to say. I was very happy to get the link in my email, and I wouldn't have known about it if you hadn't sent that to me. So thank you. I'm just here as a resource for you as well. I worked very closely with Senator Frocht on Cascade Care, and I think as we move forward, we're going to see an expansion of that. So would love your feedback. And certainly your support for next year, because I do think that that is an office that is going to be crucial to making sure that any universal healthcare plan is implemented effectively and efficiently and fairly for the consumers of the state. And that's all I wanted to say.
Thank you, thank you, thank you. We were focusing on legislators, which you are, but we do, I think your emphasis is that we should be including people in key positions across the state. So thanks for those comments, Senator. It's interesting that we're getting comments thrown in. We haven't noticed that in previous Second Wednesday speaker series. I think we could interpret that as a good sign that more and more people are starting to ask questions. So, Sandra, can you unmute yourself and talk about anything to add to the conversation about legislators or the other people that are in positions in our state government or healthcare entities that can, or insurance commissioners' offices that can really have an impact on the work that you've been doing in Oregon?
Well, it's wonderful to hear Senator Kuderer. She makes some points that I think are really important. One is about insurance and one is about intelligence in legislators. It has been, as we have had a number of bills before the Oregon legislature and seen public testimony in support or against the bills that we have been championing, it has become clear that the overwhelming amount of opposition as presented to the legislature comes from insurance companies. And their reasoning is generally weak, not evidence-based, but what they say illustrates the importance of being very clear about the distinction between single payer on the one hand and universal health care on the other. Because our insurance companies say, we love universal health care. We want everybody to have health care. We just disagree on how you do it. And our recommendation is get a little more tax money and give it to the insurance companies so they can provide healthcare insurance for more people. Give enough money to the insurance companies and they say they will provide healthcare coverage for everybody. If we are not clear that that's not what we're talking about, we're talking about a form of healthcare finance that improves the justice in the system and saves money for ordinary taxpayers and regular people. We push the justice and the money-saving aspects of healthcare finance. It is not going to be running through the insurance companies. It's going to be establishing a single-payer system. Now, hearing a really smart legislator talk about stuff is really encouraging to me. I happen to live in an area in Ashland, Oregon, with a very smart state representative and a very smart state senator. And when they were first elected, they didn't know much about single payer or about the work that we were doing. But if we had gone to them only with, it's not working, I want you to fix it, they would not have listened as deeply as they did when we came in knowing what we were talking about. And because of the work of our statewide organization, had plans, proposals, bills they could vote for, bills they could sign on to as champions, as sponsors, they realized that this was a serious movement and a high quality movement. So I would say that an important thing to remember if you're a statewide movement working with the legislature is one size does not fit all. We need every level of approach to our legislators. We need people who will say, I got hurt by the healthcare system, fix it. We need a lot of people to say that, but we also need people to say, I will sit down with you. Here's what I think is the next thing you need to know about what we're doing, and who can go beyond that and say, here's the next thing after that, and help legislators who are willing and interested and able to really learn what the system is about to help them learn more. I think our general topic here is our role with legislators. I think there are some legislators we're probably going to more or less write off. They're never going to vote for single payer. We can't write off the people in their district, but some of them are never going to vote for single payer. I like to think we can talk to them and make them oppose it less, but that may not be right. And we have some people who are going to be for single payer all day long. We don't even have to say boo, and they will be there for single payer. We have some people who are weak supporters of single payer, and we have some people who need convincing. And These are people in the middle. If we have Democrats who aren't sure about single payer. We have Republicans who might be able to be peeled off, maybe not, might be able to be peeled off to vote for single payer in the legislature. But those are people who need to be worked on really, really hard. And it's all levels. It's the basic level. Healthcare hurt me, all the way up to, here's what's in this bill. You want to talk about section 48A of the bill? Let's talk about that. We need people who can go from the movement, advocates who can reach out to legislators at whatever level they're at.
Thank you, thank you, thank you. So the third question about our role is with advocacy groups. And I think we've addressed some of that to a degree, that social justice groups are an opportunity, or give us an opportunity to share our message from a social justice perspective. And that is important when we look at building a universal healthcare system. It is important to look at equity and access, and then the best ways to get the healthcare services out into the community. And talking to people is certainly a way to educate them about what the issues are, but there also we have a role to help pull those groups together. In Washington State, we have a coalition of groups called Healthcare is a Human Right, of groups that may have other primary issues, but will address the specific issue when we bring the social justice ideas or the core mission and values to them. And it's so powerful and useful for us in Washington to be seeing people from retirement groups, from, as Sam shared, the Physicians for a National Health Program groups, from League of Women Voters, from labor groups, from others, healthcare related groups. It's so important to be pulling them together. Sam, Charlie, could you comment on what's happening in Oregon? Is there a group or a coalition, or is Healthcare for All Oregon really playing that role themselves?
So a couple things. I mean, HCAO is a coalition organization, and so there are many member organizations that have a different major purpose than single-payer healthcare, but are supporters of single-payer healthcare. One of the things that HCAO has not done as well as a lot of people would hope is reach out to the members of those coalition organizations. So I think that's something that is going to be worked on and will be likely done better soon. I mean, it has been done to some extent, but not as much as it probably can or should be done. So another thing that's, I think, important is for individuals within the single payer movement to help with the major issues of those other organizations who are other justice organizations. Sometimes it's appropriate for a single payer organization to actually endorse and work directly with another justice organization. Other times it's more appropriate to provide that help as an individual who is known to be a single payer advocate. And so you have to kind of discern what's best in each situation. So, for example, HCAO has been part of the, oh gosh, Sandra probably knows what the name of the effort to do major bills in Oregon is, the Justice Organization. I can't, the name is slipping me right now, but it is.
Do you mean Fair Shot?
Yeah, Fair Shot.
Fair
right.
Shot. Mm-hmm.
Yeah, so there are times when it really makes sense to advocate within a single payer organization for something else, for another justice issue. And sometimes it's not. So I think you need to play that. Be careful with that and do it in an appropriate manner. It's also very useful to, again, reach out to these organizations in a way similar. You might reach out to them as a general public, but to reach out to them and give information to the members of those organizations. One of the examples that I think has been pretty useful in Oregon is reaching out to county Democratic parties and having them be member organizations and to present information to them on a fairly regular basis. So, and also to make sure that the issues that we think are really important are part of the platform of the party. So I'll stop there.
I just absolutely everything Charlie said. Plus, you find allies in odd places. To me, odd. I mean, one of the stronger outreaches from HCAO has been the Faith Caucus. It is amazing how many congregations are quite prepared to leap on a social justice issue, and not that hard to convince that single payer is a kind of social justice issue that responds to their beliefs and their faiths. To organize an organized outreach to faith groups, getting their support and getting them to sign on as paying members of the healthcare movement, I think has had some benefits. The set of organizations we really need, though, we absolutely have to have if we're going to succeed, is labor unions. We have to be able to have a strong alliance with labor unions. And I think what Charlie said is absolutely right. The best way we're going to do that is if we have single payer advocates who are already strong in the labor movement. And when they say, hey, we should all be for single payer, that has more credibility than somebody coming from the outside and saying, you should be for single payer. Notice the difference between we should be for single payer versus you should be for single payer.
Thanks, Sandra. Marcia, can you throw in any or add any comments about those the power of those allies?
Oh, definitely. I mean, there are many of them on this call today. And I know that we have recently, there's the Unitarian Universalist Church has a every congregation has a strong social justice movement, and we've partnered with them in presentations. And also the Jewish congregations, they also have social justice groups, and they're very, very strong on this issue. So I just second what Sandra has to say. And we're so grateful that the Washington State Labor Council is part of Healthcare as a Human Right, because that is something that Healthcare as a Human Right as a coalition organization is really good at reaching out to labor people in the labor movement and workers. So shout out to them and to the people on the call today that are from that organization: David Loud, David McClanahan, Claude Burfect. And I hope I didn't miss it. I probably missed somebody, but appreciate all the work that you do there with a very necessary component of our movement. That's all I have.
Thanks, Marcia. And so there are a few questions that have come up in the chat that I think we can answer when we get to Chuck Pennachio's comments about where the role single payer can play by going through the states. But there's a couple more questions that we discussed or wanted to share the discussion with you. One was about overcoming barriers, and even though legislation is passed, even though commissions or task force are created, there's something we need to keep aware of. Sandra, do you want to start us out on that next step on barriers that we still need to overcome?
I think in some earlier draft of our work together, we talked about lessons learned. And I think that to me, it means the same thing, but the biggest lesson I've learned in my years in the Oregon movement the biggest lesson is you can't ever let anything slide. I call it eternal vigilance. When you think you have an ally, you have to maintain that relationship because people can change, people can slide, people can say, oh, I don't need the support of the single payer people as much as I need the support of the public option people. So I'm going to weaken my support so it's not going to be as strong for single payer as it used to be. We can set up a whole thing like a chapter or a statewide organization of, as Charlie mentioned, the legislative constituent contacts. And if you don't maintain it constantly, it can slide into disrepair. So that's the biggest lesson I've learned. I think the biggest lesson, my concern about working through the legislature is that, well, for one thing, legislators' loyalties can change, but for another, they can work behind closed doors, and in trying to make compromises to build their support, they can kind of shove us to the wings or leave us outside those closed doors. And I don't think we should let that happen. We have to be eternally vigilant and maintain every relationship we've established and every institutional structure that we've established. I haven't seen one yet that was useless enough we could let it go. They're all really important.
Thanks, Sandra. Thanks. So eternal vigilance is important, and just like they say, if they don't give you a chair at the table, bring your own chair. If they don't give you a seat at the table, bring your own chair. Charlie, can you have anything to add to Sandra's comments about eternal vigilance?
Well, I will completely agree with eternal vigilance, and part of that is vigilance on, for example, the Oregon Task Force on Universal Healthcare. You have to watch what they're doing and make sure you understand what it is they're doing and advocate if it seems like it's going astray. And I would expect the same thing is going to be true, or has been true, for the Washington Commission. The other piece about lessons learned, I would say, is that one of the things we have learned is the importance of specific language in bills, that you really need to have a bill that is as specific as legislators will allow you to make it, I would say, because we found, and this is especially true with the task force, where we actually did have some good specific language, we were able to bring that language up, and the task force members themselves would bring it up and say, well, what is it we're really supposed to do? Oh, this is what we're supposed to do. And if it's written well, that specific language will lead them in the right direction. And if they sort of go astray and they're not bringing it up themselves, you can bring it up to them and say, well, this is what the language says you should be doing. Can you try to do that? So it actually is very useful to have that sort of specific language about including about principles and values, which is, we actually do have very good language about that, but also about what the system could look like. So I'll stop there.
Thanks, Charlie. And so, Marcia, can we get you to wrap up a comment on the lessons learned about barriers to overcome, and maybe add the last question, get us started on the last question, which is, a brief comment on what gives you hope.
Okay, well, I second Charlie's eternal and Sandra's eternal vigilance, and in fact, and the specific bill language. In fact, Healthcare for All Washington actually helped write the bill that suggested amendments for the work group bill and also for other legislation as well, and for the commission bill to make it stronger, to include more members of the public, to include labor in the work group, just a number of items that we successfully got the legislature to add. So it's very, very true that that works. And then eternal vigilance also on monitoring how the commission is doing its work. And are they going fast enough? And how can we make it faster? Because they're not going fast enough. That's the thing. That's a barrier. They've got a management group that doesn't seem to be on board with the mission of the group. But it's, and so we have been meeting with individual commissioners and with the facilitators on a one-on-one basis, because we can't meet with a subset of the group. That would be a violation of open public meetings. But if we meet with one work group or commission participant, then it's kosher. So we've been busy meeting with all those various agency heads, some agency heads and some important people that we need to get to. And so they have encouraged us to reach out. So that's been a learning experience. We weren't sure how much of a voice we could have in the process, but it turns out we can reach out and ask for meetings whenever we see a need. And that is huge. And so now after 2 years, we realize that we can do that. And then the other thing is that we've been suggesting ways. We sponsored a bill proviso in the legislature last session that gave the commission more money, gave the healthcare authority more funding to actually hire some actuarial experts and some more staff to speed up the work of the commission so that it can get to its mission, so it can accomplish its mission within our lifetime, hopefully, and much earlier than the end of our lifetimes. So just keep working it, just give vigilance, just think about what you need, what's the next step, how can we help it? Instead of saying it's not going well enough, what needs to be done, and who should we approach, and what should we ask them to do? So yeah, that's it for me.
And that too gives me hope that there are people out there who are interested. We saw Senator Kuderer show up here tonight and add her comments, but in our experience, we've shown up at offices like hers, where our primary healthcare champion brought us in, and other people showed up. I think Senator Kuderer, you brought Lisa, the senator from the 41st district in, Senator Wellman, and so it like grows one by one, and that's what is giving me hope, is seeing that people are responding to our requests. They're hearing what we say, and they're including their own values and making that happen. Let's bring on the executive director of One Payer States to add some comments about one of the questions that has been showing up in the chat tonight. And Chuck, I'm not seeing a way to add you here. Why is that? Chuck. Spotlight, there you are. That's not you. Sorry, Charlotte. Do you want to pretend like you're Chuck? No.
You go. You can,
Let me try the magic
thank you.
fingers again.
you can
Or maybe Chuck has left
There he
us.
is.
hear me?
I can hear you, but I don't see you on the list. Have you changed your name again?
Of course. It's Nom de Guerre, right? It's my fighting name, my war name. But Charlotte's absolutely welcome to channel her inner Chuck, if that works. But this is amazing what you all have done this evening, and what we've done over the years, and the meetings that we've had, and the trips I've taken out to the Northwest to meet with all of you. And I'm very excited for where we are. And frankly, I take the disruptor as a positive sign, because we're making success. And that's what you get when you're moving forward, is that you're attacked. Isn't that what Gandhi said? First they ignore you, then they attack you, and then you win. So this is the path to victory, and nothing's simple. Nothing is seamless. Nothing is without disruption. So I threw a lot of stuff in the chat. I hope that folks will save the chat. I put some organizing ideas in there, take them for what they're worth. I believe that the work we do begins with visualization. We talked about this on July 15th, and a lot of people picked up that thread, and that is visualize the world that you want, the world that we need, the world of justice for all. And that is empowering in and of itself, to keep that vision at the forefront of your thoughts every day when you hop out of bed. It's not easy work, but you know, this is where I've come over the last 5 years after 50 years of organizing. There were some questions in the chat, if I could just address those real quickly. People were asking why state-based universal health care. Well, it has to do with our history. It has to do with our Constitution. It has to do with opportunity. And the federalist system. I mean, Canada came to national health care through a single province. And here we are with Washington and Oregon on the cusp of adopting a universal healthcare system and modeling it for the nation. This is extraordinary. Anybody who ignores that is simply not paying attention or doesn't want to pay attention to the inevitability of getting to a universal healthcare system nationally through the states, through the modeling. And this is the way that most of American history is unfolded. Our social, economic, and political justice and development has come through the states. So that's very exciting at where we are right now. And then the organizing strategy, it's the 3 Ps. It's people, politics, and policy. We connect the 3 Ps, people, politics, and policy. And where does the hope come from? Is anybody paying attention to what's going on in Los Angeles right now? Labor unions are piling on in support of the Hollywood actors and the Hollywood writers. We're seeing the hospitality workers. We're seeing a labor union movement develop further in San Jose and across the country. So there's extraordinary work that's happening right now. We're approaching general strike territory in a number of cities throughout the country. I think we're on the cusp of something absolutely extraordinary. So I just have to say that I am filled with radical hope. And I think that it also begins with radical hospitality, which is welcoming the conversation with everyone. And even that includes Trumpers. That includes people who really are just desperate to find a pathway forward. People are looking for some way to figure out how their lives can be made better. So I think we need to be open to the conversation. And again, it begins with visualization. Radical visualization. So I hope that helps, Ronnie. What I wanted to say is that in the chat, concretely, I included a link to the legislation that's coming up. It's based on the 2021-22 bill that Ro Khanna introduced. The new language will come out at the beginning of September. We need to get members of Congress signing on as original co-sponsors. I gave my contact information in the chat. I'm moving to Washington, D.C. I'm going right into the belly of the beast. No one has done this before. There's never been a single payer organization that has made a full commitment to going in and advocating for single payer specifically. We have friends, we have allies, but this is the time to actually roll up our sleeves and make this happen. And this is what I'm committed to over the next 2 to 4 years as Oregon and Washington cross the finish line and we get enabling legislation, the super waivers that are provided for in the state-based universal healthcare legislation of Ro Khanna. I also put links in there to contact your staff members of your members of Congress. We have got to get these folks educated and motivated and believing that this is what needs to be done. Right now, the focus of the single payer community is primarily on deprivatization of Medicare. Their efforts right now, as you all know, I imagine, that the insurance industry is trying to radically privatize and destroy Medicare. And I get that, 100%. We need to support those efforts. But on a parallel strategy, we need to take the offensive, which means supporting this legislation of Ro Khanna, the state-based universal healthcare legislation, HR 3775 from the last congressional legislation. The new bill will be introduced right after Labor Day. And that's our pathway forward to making sure that the states have the best opportunity to introduce the absolute best single payer systems possible. Thank you so much, everybody. I'm calling in from Pittsburgh, so it's a bit late here, but the fight goes on. It's across the nation. Everybody's eyes are on Oregon and Washington. Know that you're carrying the nation. You're modeling what needs to be done. And what's happening in the territory of the Northwest, the great Northwest, is just firing folks up. So really appreciate everything you do, Ronnie and Sandra and Charlie and Marcia. Your contributions are amazing, and everybody else who participated tonight. Thank you so much.
So I want to thank everyone also to Sandra and Charlie and Marcia for joining us, to you, Chuck, for inspiring that summit where 23 people from the Washington and Oregon put their heads together and struggled with the issues that we tried to share tonight. I want to thank Ron Lovell behind the scenes, but most of all, I want to thank each of you for joining us tonight. This shows a great commitment to making universal healthcare happen. Even the Zoom bombing or the interruptions we got are telling me that people are paying attention. Join us for our next Second Wednesday speaker series on September 13th. Brad Finegold, who works with Public Health Seattle and King County and is addressing issues on substance use disorder, on transitional steps there, such as harm reduction, but on developing services and on the current issues around in our state around decriminalization of substance use problems. Certainly Oregon has a lot to share with that issue too, as they are working around those same issues. So we'll see you on September 13th. Thank you all. Thank you very, very much.